Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Hey, welcome back to the Hope Natural Health podcast. Last week, we discussed obesity and how we can fight it. And now let's dive into this week's episode. I am going to be talking about testosterone for women and weight loss. Women need testosterone as much as men, just not as much as men. Just like in men, it declines with age. It's estimated that women in their 40s will have about half the amount of testosterone that we did in our 20s. Testosterone in women is produced in our ovaries, our adrenal glands, and our fat cells. So what are some common signs of low testosterone? The big one I get in office is libido. That is a huge one, but we can also have other signs of low testosterone, such as fatigue. We have a decreased endurance. We have a decrease in our lean muscle mass, a decrease in motivation, diminished work or physical performance, obesity. We might have signs of depression, cognitive dysfunction like brain fog, poor memory, or concentration. Even irritability is a sign of low testosterone. So why is this important? Well, some consider these symptoms just part of aging, but this can also lead to stress, which leads to inflammation, which then leads to weight gain and added fat. So women, unfortunately, gain weight easier than men. And this is because of the fact that we have higher levels of estrogen. And as we age, these levels actually will fluctuate. So if you're a patient of mine, you know that your hormones can be all over the place at all days of our cycle. So as we age, our ovaries become more and more tired, which leads to less progesterone production and more estrogen. And if we have excess testosterone, this can also convert to estrogen, therefore causing weight gain. So low testosterone can lead to a loss of muscle mass, and muscle mass helps us burn calories or burn more calories than fat and keeps our metabolism super robust. So if we have less muscle mass, we're therefore going to gain weight. So we need to increase our muscle mass, and testosterone can help with that. Testosterone is not only deemed a sex hormone, but if you're struggling with weight loss, we need to make sure that we're asking our doctors to look at our testosterone levels. Because if they're low, you can get testosterone replacement therapy and literally feel like a new woman. There's been a couple studies that were published that I want to talk about the effects of the results on the testosterone replacement. So there was a study in the Journal of Clinical Endocrinology and Metabolism showed that women who were given testosterone therapy lost 2 times more body fat and gained more muscle mass than a woman that was given a placebo. Holy cow. And then another study published by the New England Journal of Medicine in 2000 reported, and this is a quote, randomized, double-blind, placebo-controlled study examined effects of testosterone patches on 75 women aged 31 to 65 who had undergone a hysterectomy and bilateral oophorectomy, which means the removal of both ovaries. Hysterectomies with or without oophorectomy significantly decrease circulating levels of testosterone. Because remember, testosterone can be produced by our ovaries. Over 3 consecutive 12-week periods, the women were given placebo, 150 microgram testosterone patches, or 300 microgram testosterone patches. The unequivocal result was that women who received 300 microgram patches showed a significant improvement in sexual function, mood, and general well-being. As mentioned in these studies, there's various routes of administration of testosterone. So the options are doing a lozenge or a troche, which is a dissolvable little lozenge, essentially, that you put under your tongue. You can do a cream. There are testosterone injections, and there are also a procedure with a pellet that is an insertion underneath your skin. You can discuss with your doctor the pros and cons of each of these and make an informed decision for which is best with you. And don't worry, if it's dosed appropriately, you will not turn into a hairy man. That is a common concern I get from a lot of my patients, is that if they take testosterone, they're going to they turn into a man and become super hairy. Now, if it's done right, monitored properly, you're not converting your testosterone to estrogen, etc., everything is fine and dandy, and literally testosterone can change your life. So if you're struggling with any of these signs or symptoms, make sure you ask your doctor to check your testosterone levels. I promise it might be game-changing for you and your health. Thank you all for joining, and I look forward to seeing you again next week.